just so many different kinds of therapy and therapists, different
Right.
modalities. And as a consumer, I think when you think about therapy, it's like, I'm just gonna find a therapist. But right there, you're gonna fail. And you're gonna feel disappointed in the process. You're gonna feel like therapy feels.
Thank you so much for joining. I really appreciate you taking our time. And I think the good starting point will be if we get to know a little bit about your journey in this in your field of expertise, and we would also love to connect that with your vision and passion behind your current business.
Okay, well, thank you for having me. You want me to start by saying my journey of how it started?
Right, right.
So I currently I'm a practice owner in the city of Chicago. I am the founder of MARRA. For those that don't know what MARRA stands for, MARRA comes from the word Maratatuyari, which is a word from my background of central Mexico. And we have dialects, and it represents deer. And deer is a sacred animal that represents the best version of yourself.
Right.
At Mara, we are not just a mental health studio, but we are a practice that really values healing in community. That's
Yeah.
why we're so big on offering therapy in group settings or just support groups. Because as much as we are doing one-on-one work, the belief is that we really heal when we are with others that are going through the same things that
Right.
we're going through.
Right. Understood. And as far as I put little bit research into Mara, so it went through a rebranding phase as well, if I am understanding correctly. So I was really looking forward uh, to understanding your philosophy behind putting this organization through a rebranding phase and how it's helping you right now.
So there's a really good reason why we went through a whole rebrand, because as you know, rebrand is not just changing the name, it's not just building a new website, it's about how you position yourself in the market. So we were formerly known as Balance Psychotherapy. But
Right.
the issue with that is that think about the word psychotherapy and how that automatically
Yeah.
boxes you in a medical model. And like I said, our philosophy is not just healing does not just happen in a medical model. It happens in community. So Mara felt like a more authentic, intuitive way for us to position ourselves in the market.
Right.
The trend that we're seeing nowadays with mental health is that more people want to have access to take care of their mind, but therapy is intimidating. Going to talk about your feelings in your life one on one is not for everyone. And rebranding Mara is giving people more access to say, hey, there's different ways for me to take care of my mental health that is not just therapy. So the rebrand is really the birth of a brand. So what
Right.
you normally don't see in mental health, talking about a brand,
Right.
that's what we're building with Mara, a brand.
Yeah, that's very powerful to hear. So I, for the sake of our listeners, I think you are offering many different kind of therapies. If you have to cover just a few of those that you are doing, what are those, and if you have to talk a little bit about what is your philosophy or what is your process about identifying who should go in with what type of therapy. So what basically goes behind the scene or under the hood for you to identify which kind of therapy is going to be useful for your patients.
That is a really good question, and thank you for asking that, because I think as therapists, we're gonna put in one basket, like go see a therapist. And what I hear from consumers is that therapy did not work for me, therapy did not feel like it was moving the needle. fast enough. And what I'm going to say, and it's going to answer your question, is that perhaps it did not work for you because you were not seeing the right kind of therapist. In our industry, we have so many different kinds. So, for example, if you are someone who is diagnosed with ADHD, you have a high job pressure, you are an executive, I would really recommend going with someone who has an expertise and training with working with people with high pressure careers and also has training in ADHD.
Right.
So, for example, at MARRA, we're a multi-niche practice. We have different, because we're an ecosystem of therapists, we have a therapist for everyone, like different niche. So it really comes down to you first as a consumer, making a list of what are the 3 top priorities that are obstacles in your life. Example, executive functioning could be one. That as a high performer, I do not know how to do stress management, and I bring that stress to my family. And perhaps number 3 is that I'm noticing some attachment injuries in the way that I lead my team, right?
Right.
Are we still here or did I lose you?
Yeah, I think
no,
I
think we
was
did
not
we
able
lose each
to.
other?
Yeah, for a brief moment, but if you can just rephrase what you were saying, it would be helpful because I think we froze for a few seconds in between the conversation.
Yeah. So I will. So what I was saying about what are the kinds of therapy is that there's just so many different kinds of therapy and therapists, different modalities. And as a consumer, I think when you think about therapy, it's like, I'm just gonna find a therapist. But right there, you're gonna fail. And you're gonna feel disappointed in the process. You're gonna feel like therapy fell short. Because Aun, you don't know how many people I hear talk about therapy did not work for them.
Right.
And that's why you were asking me what goes into it. It really comes down to you as a consumer.
Right.
You need to come with a clear list of what are the top issues that you want to work through.
Right.
And based on those issues, you can really assess the expertise that you're wanting. Example, if I'm getting a divorce, I'm not going to go see any attorney. I'm going to look for a divorce attorney, right? It's the same with therapy. If I am a high-end executive with a high-pressure career and a lot of responsibilities, I probably want to look for a therapist that has experience working with folks with high-pressure careers.
Right.
So, and asking for a consultation call. That's a piece that a lot of people miss.
Right.
A consultation call just to make sure that it's the right fit and that therapist has the right training. Otherwise, yeah, you're gonna feel like it's disappointing.
Right. Understood. Thank you for explaining this in details, and I'm sure it's going to be useful to our listeners. And I want to linger on a little bit more on the similar subject. Do you feel that there are still any misconceptions out there in terms of seeking help in this area, especially in the area of mental health? Or do you feel that it has improved and you are not saying that people are more and more open to seeking help in this domain?
I am lucky enough to live in a city where mental health is seeking therapy is normalized. I mean, the city of Chicago is a really progressive city, so it's almost looked down upon if you don't have a therapist. Like, oh, you don't have a therapist? Like, what's wrong with you? Sort of thing. However, something that I am noticing is that yes, there's still the misconception that you truly have to be struggling to seek therapy or to seek support. Because listen, it's not just therapy, it's support. Could be many things. Could be medication management, could be community, could be just asking for help. So I do think we still have a long way in
Right.
continue normalizing. Like, hey, therapy is not for just when you are down the drain
Yeah.
and you've hit rock bottom. Therapy is a way to really get to know yourself better. And
Right.
guess what? That is the best gift that you can give to yourself, and also you can give to future generations. Because when I am getting to know myself,
Right.
when I am breaking cycles, I show up better as a leader.
Right.
I show up better as a parent. I show up better as perhaps as I'm a as a daughter.
Right.
And that in itself, your work trickles down to everyone that is around you. Everyone benefits from
Right.
that. So I really would wish people would seek support sooner rather than when they're in crisis.
And I think again, this self-awareness is so underrated, in my opinion, that it's such a big power, such a big skill set, and of course, things like that are really helping a lot on helping people become more and more aware of their own self, and which, of course, as you said, helps on many different fronts. So I want to ask you a little bit more about the way your practice works. And when we have been talking to many mental health executives and founders for last 2 weeks, and one thing we notice is the trend is changing. Now they are going more towards virtual care as well, or online consultancy as well. Is this something which happens at MARRA as well, or you are purely focused on in-person visits, or you are also using technology or virtual care at the moment?
It's interesting you ask that because I've been talking to my team about that. And yes, in 2021 to 2024, even just a little bit of last year, the trend was to go virtual.
Okay.
No client was wanted to come in person. Our office was basically not being used, but trendings are changing, and I think 2026 you're gonna start seeing a bigger shift towards people wanting to come in person. And the reason why that is because there's a big movement for living an analog life, a life without being attached to devices.
Right.
And when I am seeking virtual assistance, like from a therapist, that means that I need to be linked to my computer or my phone.
Yeah.
So, to answer your question, yes, that trend really exploded our industry in ways that could not even imagine. But now we're seeing a demand for people wanting to come back to a ritual of
Right.
coming into an office, a ritual of really being in a sacred space where they can come, work on what the things that they need to work through. And guess what? That energy stays in that office.
Yeah.
That energy, you don't bring it with you or lingers in your home. At MARRA, we offer both because we work with professionals. We like to offer that flexibility that if you cannot come into the office, hey, jump on your computer and we'll
Right.
meet virtually.
Right.
However, larger trends are shifting towards more in person.
Got
At
it.
least for millennials. Gen Zs are still really
Yeah.
into a more of a virtual
Right.
space. But I see that shifting too, to be honest with you.
Got it. So I really want to explain one thing, which again, just talking to somebody, and they were working in mental health space, and they don't have office. It's fully virtual. And one thing they have implemented is that just like you and I are talking, they have artificial intelligence in place where they are doing sentiment analysis on patient as well, and AI is doing it, and after they conclude their call, of course, the doctor has their own view, they have their own assessment, they have their own opinions, but AI is also providing them another layer of insights on the conversation with respect to different sentiments and the choice of words or expressions, which is really helping them get some more useful insight. It may not happen for every call, but let's say if 2 out of 10 calls or 2 out of 10 virtual meetings, if AI is suggesting them or technology is suggesting something that is helping them get a little bit more insight or understand their patient a little bit better, I think those individuals or those folks were really looking forward to using technology more and more. So I understand what you are saying, 100% totally agreed with that, that in-person touch is, there's no alternative to that. But do you believe that still, in any case, there should be a fine balance of using technology as well for cases like this where technology has potential to give you insights which sometime as a human we may miss or we may not notice if we are talking to one patient regularly and we are used to the typical conversation and typical styles of them.
I do think with caution is a really powerful tool. You did say something about like really getting comfortable that sometimes you may miss on things. However, something that artificial intelligence does miss is body language and cues. Because if it's just only listening,
Yeah.
in my experience as a practitioner, it adds layers that were not even there,
Right.
right? So I think when you are using it with caution, you're a professional that is also getting your own consultation with a team can be a really powerful tool to bring insights that you could have missed.
Right.
But I think more importantly, I think could be really helpful for you as like a third eye, a third eye in the room
Right.
that can say, hey, this patient really brought up a really good point, and that could have been an opportunity to deepen further on that, but instead you stayed silent.
Right.
So I think it would be really important for the therapist to have a tool like that allows you to grow as a therapist. And at
Yeah.
the end of the day, the client benefits, right?
Absolutely.
Because, so yes, I think that would be a really exciting development. But I said also with caution,
Gosh.
because in my experience using AI, it can add things that were not even part of the presentation that you're like, where did that even come from? But if you are not experienced enough in the industry, you could get sucked into that
Right.
and then take the sessions in a direction that are not even helpful.
Got got it. So, what sort of tools do you have in place right now? For example, do you have any EMRs that you are using? How are you managing the appointments of the patients? And likewise, is there anything you are using for effective patient engagement? For example, any software, any application you are using to reach out? Maybe you have to send them some guidelines, some instructions, for example, some video to watch. So, how does your overall technology adoption looks like at your clinic at the moment?
So we're a paperless practice. That means that we have our electronic health records is also the same system that we use to send our intake paperwork, to schedule our appointments. Everything is in one place. To
Okay.
do our billing, everything is in-house, right? In how do we keep clients engaged is this EHR, electronic health records, sends reminders to clients. It's really easy for clients to upload payment, to upload their insurance card, and for my back of the house team, it's really easy to just.
Yeah, you were saying that I think you are absolutely right in pointing out that administrative and operational things like that can be or should be automated using technology, and I think that can be the best outcome for doctors and founders and business owners like yourself, where technology can take care of a lot of things like this, where manual intervention is needed, and it's typically a routine or a same process that's done every time,
Yeah,
right?
correct.
So I have to ask you one most important question. In your day-to-day uh, in your day-to-day work, what is one challenge or frustration that come up quite often?
In my day, in my day to day, one challenge that I encounter the most as a founder in mental health is how difficult it is for people to access care. And
Mhm.
the reason why I say that is because many people are covered, like an insurance-based practice. We made that thoughtful decision because we believe that people should have easy access to care. However, that's not really happening. And the reason why that is because there's high deductibles that people are not aware of. So people come into our office thinking that they're finally going to get relief, that they're finally going to get some help. And once we check their insurances, their deductibles are so high that they cannot access help because they can't afford services. So to me, that's one of the biggest challenges that I see in the practice. But if you were looking for a different, more operational challenge, I can give you that one too.
Yeah, I think again, this what you pointed out is really important because this is impacting on the grassroots level. This is actually impacting care. But if you have to point out one operational challenge, I think we would love to include that as well.
One operational challenge that we see is managing different platforms. Like I said, right now we have our in-house platform that has scheduling, billing, and intake paperwork, but we also need to outsource sometimes. And we use other platforms where people can book appointments with us. And those do not speak to our EHR. So my biggest pet peeve is when they're just not connecting. You need a human to keep both platforms daily updated. So we have double bookings. Therapists end up with double bookings, which is a therapist's worst nightmare.
Right.
Hopefully, we have a team that can catch that early. But also, how discouraging for a client to now I spent all this time looking for availability. I finally have an appointment on the books, and I'm gonna get a phone call saying, like, hey, guess what? That's no longer available. So I would say, and I think it comes down to what you were bringing up, perhaps artificial intelligence and automation would be so
Yeah.
beautiful
Yeah.
and useful.
Yes. And I think my always recommendation is that businesses should start getting AI or technology help on exactly challenging like that, administrative challenges, operational challenges, and things that can be easily overlooked by humans when multiple people are working and one person can end up making one for example appointment and another person uh, might be able to use the same slot for booking up the second patient. So I think in scenarios like this, AI and technology has immense potential to make things easy and streamline our operations. So this is where a lot of industry leaders and CEOs like yourself are looking forward to start small, start adopting any small tools or small AI gadgets that can really start addressing these small fractions, and they eventually end up making huge impact not only in terms of actual care but also in terms of reducing the frustrations in your team members, in your patients, and of course eventually helping you save a lot of costs. So I think it can be some
Absolutely.
for you. I think it would be a good idea to keep applications or tools like that on your roadmap for adoption, maybe this year or next year, whenever you feel the time is right.
Definitely looking forward to that. I
So,
think it would just, I would just wish as a founder and as a business owner, like someone would just say, "Hey, these are the tools that you need to use," right? Because there's just so many
right,
that there could be a service or a person that says, like, "I did a analysis of how your business operates. We did an audit, and these are our recommendations of the top three, and we're gonna install them for you." I think
right,
that's the biggest challenge as a founder of why sometimes we don't pursue because it just feels like it's such a big undertaking and
right,
disruption
yeah,
to change what we are so familiar with. But that is part of the challenge, and I know I'm up for it.
yeah. And I think this happens, in my humble opinion, is that because you are wearing so many hats right now, you have to make sure that you are taking care of your patients. You have to make sure that the business is running, and it's also not an easy thing to manage only the business front of that. And of course, you might be hiring, you might be bringing new people in. You have to make sure that the staff you have is aligned with your vision, with your mission. They are culturally fit. They are providing the same quality of care that you are, or you are expecting them. So when you wear so many hats, it really becomes difficult for you to go into that mindset where you really start evaluating tools and see what's working for you or what's not. It's a
Yes,
big ask from a founder who is managing so many things already.
you could not have said it any better. You
Right.
hit it. Yeah.
But do you also, apart from your clinical staff, do you also have team members that are helping you on the business side of things as well? For example, marketing, social media management, or technology aspects of things, or are you also, or is it something on your roadmap to have in your company in near future?
Yeah, we do have that. I don't handle any of those aspects. In the role that I am, I'm exclusively a clinical director, which means that I supervise other therapists. I make sure that we are in compliance with the code of ethics, that we are providing the best service, and our clients are getting the best treatment. So in-house, we have someone who is in charge of accounting, someone who's in charge of client-facing operations, and also community outreach and marketing.
Got it. So if we have to talk about big picture vision for you, where you want to see Mara in next 3 years?
Okay, am I allowed to dream for this one, or do you want me to
Yeah.
keep it conservative and realistic?
Maybe universe is listening to us. So let's go with bold and bigger dreams.
Okay, so if the universe is listening, Mara is the place to get therapy in Chicago. And I say Chicago, and I did not expand further because that's where we have our clinical license.
Right,
Mara is collaborating with brands in partnerships that are just not mental health, could be a probiotic, could be Mara is well known not only as a place to get help, but as a mental health brand.
right,
We are a place that is known for community building. And like I said, yes, my biggest initiative for 2026 is to bring more groups to
right,
our practice, but also to really start partnerships with uh, brands that also align with mental health.
right,
Could be sleeping gummies, could be probiotics, could be workout studios, because we know that mental health and movement go hand by hand, and mental health and gut health go hand by hand. So really tapping into what does it look like for a practice, or I call it for us a studio, to go beyond just serving clients, like really starting a big movement.
right. Understood. Thank you so much, Lisa, for your time. And I think I loved hearing your vision, your mission, where you want to go, and how you are currently managing the quality of care. I think it is very inspirational, and your story can become inspiration for many others to follow. Especially the dream for all of us is to have better healthcare, accessible healthcare, and affordable healthcare. And I think with building a good community of thought and like-minded leaders will definitely be helpful in this area. So I really appreciate you taking out time for this great conversation, and we are looking forward to getting your story out in the public.